Gloria Strode, and welcome to Straightforward. Today we have the awesome team from Renal Associates, Dr. Smith and Carrie Whitehead.
Yes, ma'am.
I called you Underwood earlier, the star. Yes, so Dr. Smith, we are continuing to educate our community, and today you wanted to chat with us about organ donation.
Right.
And how our community really should get involved and
Absolutely,
why.
absolutely. So, you know, as you mentioned, we've talked about other health-related, renal-related health issues in the past when we've come on the show. And I just wanted to touch on two topics that I think we have really not talked about much, but are very much underspoken in our community, and that's organ transplantation, specifically, obviously, renal transplantation, given my field. I think that obviously people don't know about it as much as they should, and I think there's a fear. There's a fear in our local community and in our nation as a whole about organ donation. You know, it truly is a gift of life. We had organ donation month, renal organ donation month, and we did a little bit about it on the news, and you know, we
just
talked to our
inform the community.
Absolutely.
So we won't be so fearful.
Absolutely.
Right.
We talk to our transplant patients, and they come back and they relay message to us as to how it changed their lives. You know, when you're on dialysis, it's truly a life-changing event, a life-changing a thing that happens to you. And we like for people, especially younger individuals, to look at dialysis as a bridge, because ultimately the goal should be organ transplantation.
Okay, so when you have the younger, you want them to look at
always
leaving dialysis, getting an organ. But there is a
Absolutely.
way now. In the old days, it was a little difficult.
Yes, ma'am.
But now you're saying
Yes,
you're at a
ma'am.
conference and you learned a lot, which is good to continue education.
Continue education.
It's very important. And so what can we do now?
So, you know, it used to be that you had to be a certain blood type and you had to match the blood type of the person that you were going to donate. And don't get me wrong, you still need to match. However, now they have cross-matching programs. So let's say I wanted to give an organ to a friend of mine, but I wasn't a match. We could still go to the transplant center, I could be tested, and I could be matched to someone else, and they would set it up so that she receives a kidney from someone else. It's a cross-match program. So that at the end of the day, I may not have given her my kidney, but I did donate a kidney that allowed her to receive a kidney.
Absolutely. Now that is fantastic, because in the old days, if your family member didn't match, then it was just it.
Absolutely.
And so now they've grown it to where that it's a nationwide type of network. And so your chances of getting one
are so much better than it used to be.
Awesome.
And hopefully, you know, the goal is to cut down on the number of people that are waiting for kidneys, because people do die waiting. You know, people die on dialysis, people die waiting, and if we can minimize that number, that's the overall goal for everyone. So organ transplantation is a huge, huge, huge concept, and you know, marking that little box that you're an organ donor on your license is a good idea too, because if you're dead, you don't need them. And your body, your death can mean something. It can be a gift of life time and time again, because you have more than just kidneys. Your 2 kidneys would go to one person each. So that's 2 lives you've saved already. And that's not even talking about your other organs. So
what about the people that feel, well, if I say that, then they're going to find me and kill me?
No, that's ridiculous. Nobody is looking for people to kill their organ. That's like a movie title. You know what I'm saying? That's like something in a Hollywood movie.
It's a myth. It's
correct.
a myth.
And no one at any hospital that I have ever worked at has specifically tried not to care for someone so that they can die and donate their organs to somebody. It's just not the way that it works.
So we need to dispel all of those myths, because you know, once a rumor starts going,
that's all it takes.
It's really hard to just kill a rumor.
Yes, ma'am.
But we have added a new face to the team.
Yes.
So who do we have?
So as you already know, in Renal Associates, there are 5 physicians. Myself, Doctors Alapan, Alkaid, Chauhan, and our newest addition was Dr. Romanoff. He's been with us a couple of years now. Now we have added
men outside
all
of you.
men outside of myself until now.
Until now.
We have added our very own Carrie Whitehead. Carrie is a nurse practitioner that has joined our group. She's our first nurse practitioner, and now I finally have some company that doesn't have a Y chromosome.
I know, have some things in common.
Yes, so I wanted to bring Carrie on so that, you know, your viewers could see her and get to know her as well, because she's an active member of our team helping us to care for our population of patients.
And I think that's important with this team, and I do know firsthand, everybody is caring for everyone, and so they're moving around, and, you know, they work with the entire family. So now you're being added And so it's important that people see you and know something about you. Yeah,
Yes, ma'am.
so are you from Columbus? How
Yes,
did we get you?
ma'am.
Are you really?
I was born at the medical center.
Really?
Yes, so born and
Okay.
raised here in Columbus. And what really drew me to nephrology was these physicians. I've been working around them for 14 to 15 years, and they have really
Aren't they great?
shown some compassion for their patients.
And so you decided to jump on board.
Yes, ma'am.
Yeah, and so how has it been? Has it been just fast moving? Because there are some hard working people. I don't think any of them sleep. So you got your roller skates when you came on this
Yes,
team?
ma'am. It was certainly an adjustment to my home life and to my schedule. But I cannot imagine myself right now any other place because
Okay.
they're wonderful to work
Okay,
with.
and so do you have children,
Yes,
a
ma'am.
husband, another life? Because I don't, with this crew, there's some hardworking, top-notch, I mean, truly consummate professionals.
We make time for family too. That's one of the good things about our practice,
Right.
And I think it helps us to relate to people. Even though we're your physician, we're people, and we have
Yes.
families. I have a husband. I have 2 children. So I'm a mom. I'm a wife. I'm a daughter. I'm all these things. We have all these hats, but somehow through God's will, I find it where I can
And a team
manage.
effort.
Oh,
A
I have
team
a
effort.
village.
Yes.
Gloria, you know my village.
Oh,
I have
yes.
a village. I have
Yes.
a mom who is phenomenal. I have a father who is forever supportive, and I have a husband, thank you God, who
Yes.
has just made it possible for me to do all things that I need to do.
Right.
And Carrie is the newest member of our group that also will help to ease and make
Take
things
off some of that.
take off a little bit of the stress as
Oh,
well.
absolutely.
Yes.
Well, I am so happy that you came to this team. And of course, like you said, you've been watching them for 14, 15 years. So you know they have that standard of excellence when it comes to kidney care. And so what we're going to do right now, we're going to go to our sponsors at our first break, and we'll come back and we'll let you share with our audience a little bit more about what you're going to be doing for the team. Okay? All right. We'll be right back after word from some of our sponsors. Straightforward is brought to you by Chalk by Quincy introduces Excellence Redefined, timepieces of the finest technology, luxury, and class with tons of style at chalklifestyle.com. Renal Associates, LLC, a team of physicians dedicated to excellent kidney care with 5 convenient locations to serve you. Stark Avenue, Columbus, Bradley Park, Columbus, Lafayette Parkway, LaGrange, East Burkhalter Avenue, Buena Vista, and Springs Street in Warm Springs. Thai Cuisine, the area's only authentic Thai restaurant, open for lunch and dinner, Monday through Saturday, located in the Village Green Shopping Center on the 280 bypass in Phoenix City. Apple Tax Services, located at 7413 Whitesville Road, Suite 400A, as in Apple. For professional, efficient, and courteous service, call today at 706-243-2595. Apple Tax Services, a company you can trust.
Walmart's reason for supporting Thurgood Marshall College Fund is simple. We like to win. And we have been given a lot of exposure to some incredible talent. And we also believe that it's a part of our responsibility to the community to give back. This is a great opportunity to do both. It's been a wonderful experience for us through the years. We've appreciated our partnership. We believe in return on investment, and we have definitely had a remarkable return.
And welcome back to Straightforward. I'm continuing my conversation with the brilliant nephrologist, Dr. Tamorie Smith, and our newest nurse practitioner, Carrie
Whitehead.
Whitehead. I'm going to get it after a while, Carrie. Okay, Carrie, so you are this brilliant Columbus young lady, and you've joined this awesome team. What have you been doing to really help this team out?
I feel like I've been alleviating a lot of, the hardship as far as the scheduling. Being able to be at several different places at one time has been difficult for all of our physicians. And also being really able to spend more time with our dialysis patients.
Okay.
Instead of, doing a quick run-in, really listening to their concerns, seeing what's going on with them, and making any changes or adjustments that's needed for them.
Okay, so you're she's filling in for when
Yeah.
because you're covering
Right.
multiple
So anyone
locations.
that knows about the nephrology community, just sort of on a national level, nurse practitioners have become a very important role
Yes.
within our community to help us, because we have the dynamic of the dialysis unit, the office patients, and then the hospital. And so we always want to make sure as a group that we're addressing the need of our dialysis patient. We never want them to feel like, oh, they're on dialysis now, we just kind of thrown them away. They're a
Right.
very important part of our practice, and they're still our patients.
Right.
And so we thought that Carrie being here would help us to make sure that we were appropriately addressing the need of our dialysis patients, or the day-to-day needs. And rather than just seeing one of us once a week while they're on the dialysis, if we can kind of meet their needs a little more often and let them know that someone's going to be there to try and help, just ease things, and if
And
something's
answer
going on,
questions.
a little
Right.
faster and quick, and make sure they're getting the service that they deserve.
So, Carrie, you're actually going into the dialysis clinics.
Yes, ma'am.
Oh, okay. And so you're going from chair to chair and visiting and.
Yes, ma'am.
Oh my goodness. So
And the
that's-
patients love her so far.
Oh,
I
I'm
mean, we
telling
just
you.
feel like it really has met its purpose in making sure that they're getting what they need. And she also helps us in the hospital and in our office. So all of my office patients are meeting Carrie. And, once again, trying to just make things more convenient for our patient. As a mom and as a mother, if I have to be off spontaneously,
Right.
rather than having to cancel and reschedule patients who've been looking forward to this visit,
Right.
I can have them see Carrie, and Carrie can fill that gap for me.
That is really awesome.
Yeah.
That really is. Now, the thing you've probably found is some of the people on dialysis don't have a big social life anymore. So when you come and to just take a look at them, you probably end up visiting probably more with some of them than Dr. Smith would have time.
That's correct.
You know what I'm saying? Because a lot of times when you go on dialysis, your lifestyle change. If you
Definitely.
travel, that takes a lot of prior planning and things like that.
Definitely.
So when they see you, you're a captive audience, and so you are very patient and very kind, I'm sure.
Yes, ma'am.
Yeah.
Very open to conversation with them. What I have noticed, though, about going in and out of the dialysis clinics, that most of them are construed as a family. You're right, they have given up some part or some time of their life to have to go to the clinic, so there's a good bit of cohesiveness within the clinics with our patients, too. So I
It's
thought
kind
that
of
was
like
very...
a family.
Yes.
We
Yeah.
encourage that. We absolutely encourage that. And your point is extremely valid, and that's one of the reasons we felt the need for a nurse practitioner. We want somebody that can sit down and talk and spend even a little more time than we had to be able to do. And I think the patients have responded in a very positive way. We never want to give them the impression that, as Dr. Smith, I'm not wanting to talk to them and spend time
Right.
with them. Absolutely I am. But I also want them to know that if I'm not right there, if I can't be right there, I'm still concerned about their needs.
Right.
And Carrie helps us to address that.
And that's what I like about this team. Today, you might see this person, tomorrow it might be that person, but the next person knows exactly what's going on with you.
Right.
ma'am.
And so I can speak to that firsthand from our own family experience. So the at-home dialysis, of course, that's something that everybody is not comfortable with.
Right.
And of course, it was recommended for us, but I didn't want to take the responsibility. I consider myself a pretty bright girl, but I was a little intimidated by that. So you wanted to share about
We're
that.
very excited about home dialysis. We're very excited about the convenience of it and what it does in terms of lifestyle for patients. It's almost sometimes they feel shackled with the dialysis 3 times a week. It's very strict, it's very regimented in terms of you have to be here at this time and that time. You're there
Right.
for 4 hours and 3 times a week. And a lot of patients feel it's very invasive. They want to be able to work, or they want to be able to do things in their life that don't take quite as much strategic planning as that. And so home dialysis is a fantastic option for a lot of patients. Now, it's not for everyone.
Okay.
And we counsel patients on a one-on-one basis, but we feel very strongly in the practice that it's a very good modality. We have home peritoneal dialysis, which there's no blood exchange. It's a nightly dialysis where you can be hooked up to the machine, and it cleans you while you're asleep, and then you wake up and
Really?
you unhook. We have home hemodialysis. Some people are uncomfortable with the idea of hooking up at night. They'd rather do hemo.
So the hemo is for the lay people. That's
Yes,
blood.
that's blood. That's
Okay.
the blood exchange. That's the one people know about when they have a graft or a fistula. But we do have that we can offer people to do at home. Now they have to have a partner for that type of dialysis, whereas the other kind, the peritoneal, they can do it by themselves. But I think
So
both
the
are good options.
peritoneal is
No blood exchange, and
Okay.
you can do it by yourself.
Okay.
And the home hemo, there is blood exchanged, and you have to have a partner to assist you
Okay.
and train with you.
So how is this working with insurance companies? Because we live in a place where, I mean, if you just need a certain cream, you might can't get it if
Yes.
it's not in your
Yes.
plan.
Yes.
Um,
So insurance companies, far and wide, there is no problem with the home dialysis.
Really?
There's no preference of your insurance company for you to be in center versus home. Quite the contrary, quite the opposite. And our home patients, they see, now this is not evidence-based in terms of there's no clinical data to show this, because clinical data shows that they're all equal.
Right.
You know, there's no best over the other. But just from local experience and talking to my patients, the ones that are on home dialysis that do it and do it well and don't have problems and complications, they seem to have a better quality of life.
Really? So because they're able to do it while they're
More
sleeping?
flexible.
Or?
It's more flexible. It's the
Really?
flexibility of it. Not to mention, like the peritoneal dialysis, you know, the home hemo is 3 times a week. I'm sorry, the in-center hemo is 3 times a week. So you have these ebbs and flows.
Right.
You know what I'm saying, of the toxins in your blood.
Right.
But the peritoneal dialysis is every night. So you're getting some gentle cleaning every night.
Oh,
And so
okay.
that tends to, people just
It's
tend
like
to
your
feel
own
better.
kidneys working.
It's closer to that in terms
Right.
of your own kidneys work 24 hours a day, 7 days a week. You know, obviously
So that's
we're
the
not
peritoneal.
perfection. Peritoneal is the one you get every evening.
But it's not the
Absolutely.
blood.
No
and
blood.
then you can do that alone.
Yes, ma'am.
And then the hemo is the one you need a partner.
Correct.
So is that, would that still be the 3 times a week like you went to the
It's
center?
actually usually shorter periods of time, but
Okay.
4 to 5 times a week. But
Okay.
a shorter period of time.
So
than
instead
that.
of 3 hours at the clinic,
You may
be
be
2 hours at home.
Absolutely.
Oh.
But keep in mind, you're not 5 a.m. You're
Right.
whenever is convenient for you.
Exactly.
So just convenience.
You
is-
could do
is
it around
huge.
your
You can do
schedule.
it around your schedule.
And
We
like you
have
said-
patients that work.
Really?
That still want to go to work, so they may work all day and they may come home, do their 2 hours of dialysis, and then they're free to be with their families. So I think that certainly home hemo is underutilized in our community locally, but I think certainly it's something that my partners and I really are going to be looking at trying to push more, because we do think that in the long run it's a benefit to the patient.
Okay. Well, what we're going to do, we're going to take our final break, go to our sponsors, and we'll be right back. We'll be right back after word from some of our sponsors. Straightforward is brought to you by Warrior Outreach. Contact Command Sergeant Major Retired Sam Rhodes or Kathy Rhodes. Freedom Printing for all of your designer printing needs. Gunboat Plaza, Suite 18. Zeal in Uptown Columbus, where you can enjoy an intimate dinner atmosphere, and every entree is chef-inspired with passion. Dinner is served Monday through Saturday, 5 p.m. to 10 p.m. Howard Johnson Hotel, 1011 Veterans Parkway, Columbus. For an international dinner experience you will never forget. Zeal in Uptown Columbus. Progressive Funeral Home, family owned and operated since 1952. The George Ford legacy of high standards continues today in the compassionate and professional services provided. A touch of dignity for those who care. Progressive Funeral Home, 4235 St. Mary's Road. Trusted by generations. Best Care, transforming minds and bodies, leading the way in the latest techniques of medical weight loss and wellness. Certified in family medicine and bariatrics, Dr. Blunt is ready to assist in the transformation of your mind and body. Call today, 706-221-6477, or visit bestcarecolumbus.com. East Alabama Endocrinology, educating and caring for those living with diabetes in Alabama and Georgia. 1400 Bradley Lake Boulevard, 3320 Skyway Drive, Suite 602, Opelika. Take charge of diabetes and live your best life.
History is important because it shows where you're coming from and where you're going. Type 2 diabetes is something that runs in my family, which means I'm at risk. In fact, 1 in 3 American adults are at risk for developing type 2 diabetes. And knowing this, if I do nothing, that family history becomes my family's future. And my family is too important to me for that. Take the risk factor assessment today at AskScreenKnow.com.
And welcome back to Straightforward. I'm continuing this great conversation with Dr. Tamorie Smith and Carrie Whitehead. Got it right. Finally, third time is a charm. So, Dr. Smith, we really need to make a special effort. Of course, we're starting here today.
Right.
But we'll have to get out into the community more and
Absolutely.
explain to people why it's important for the kidney donation, to sign up to be an organ donor. People not going to try to track you down and take you out.
No.
You're not going to be on a hit list anywhere.
No, not at all.
But explaining to them about the cross match now.
Right.
And so we could save lives that way. Then we're going to try to get the word out about the in-home dialysis, because for the older patients or people that might not drive, you got to have a family member that's transporting them back and forth, rain, snow,
Absolutely.
sleet, hail. I mean, if it's a tornado yesterday, it didn't stop you all. You all were still working.
Absolutely. Still working. I still did everything I always do.
Right.
And, you know, it's amazing you mentioned that, because we actually do have a lot of older people who are on home dialysis.
Really?
And they, maybe one of their family members, one of their children or something of that nature has taken some responsibility and helps them with it, but it keeps them from having to get out 3 times a week and go to dialysis, and it's a very doable thing.
So is it a lot of machines, or because I
No.
know it's, and then what about the cleaning and
It's not a lot of
the
machines.
sanitation that I'm concerned about?
We teach the patient in a very programmed, step-by-step fashion how to keep things clean, sterile technique. We teach all of that.
Okay.
We have dialysis partners in terms of providers that we work with, where we train our patients, and we even have a dialysis partner that we work with where we can even offer you in-home training.
Oh, really?
Yes, ma'am.
Okay, is that the Kidney Smart?
No, that
Okay.
is, we have a company that we work with, U.S. Renal Care, and we can even provide, if you're with that company, for them to come to your home if you're going to do home dialysis.
Oh, okay.
And train you at
Kind of
home.
like an on-the-job training at home.
Train you in your own home.
Okay.
And they train you, they come to your house when it's time to draw blood for monthly labs. They come to your house and draw that blood. Now you do have to come to our office for an office appointment, come to our office where, you know, that company is providing care with us. But a lot of our patients love that option. You know, I always say different strokes for different folks.
Yeah.
We have a little bit of something to fit everybody, we like to think, because our whole goal is that dialysis is not the end of your life. We just
Right.
want to make the rest of your life here as quality as we can.
Right, and so you were saying, and you've said it many times before, you are a nephrologist.
Right.
You all see people with kidney disease.
Right.
Everyone that you see is not on dialysis.
Thank you.
We need to address that.
Yes.
Right.
So people often call us dialysis doctors.
Right.
And yes, I am a dialysis doctor, but I also handle chronic kidney disease. I also handle hypertension. I handle patients with electrolyte abnormalities. I do lots of things, not just dialysis.
Right.
My goal is to keep people off dialysis. That would be fantastic. It's
Right.
not always possible. So of course we do need the dialysis, but I like for people to think about the time before that happens, because prevention is a pound of cure.
Okay, and so are you doing some of the education with the patients when they, just to make sure that everybody is knowledgeable and they're informed, so you have more time to assist them with that?
Yes, ma'am.
Because people like my crew, our crew, we had 100 million questions, and you probably would get asked that same question 10 times, you know, but that is so important because people fear what they don't understand, and that's the problem with the organ donation and probably doing the at-home dialysis. So is that something that you are going to be focusing
On yes, ma'am, education. And what I have noticed too, working with our nephrologist and working out of the office in their clinics, is that when we do receive a lot of patients or referrals that have chronic kidney disease, they're already at a middle or lower stage, and they had no clue that they were even in chronic kidney disease. So it's just really putting the education out there. And letting patients know that you really have to take care of yourself when it comes to your high
and you
blood
have to
pressure.
start paying attention.
That's correct.
Because you were saying it's almost like a car, it'll just stop, and then you realize you're in trouble.
Well,
That's
there is
right.
a point of no return when it's too late to do all this prevention, when it's just time to do some dialysis and try and work on quality of life associated with that. So we like to try and get to things before that happens so we can prolong the time before needing dialysis, if not prevent dialysis altogether.
Okay, and so what should we be looking for? I know you've talked about making sure you look at your diet, your salt, and
Yes, ma'am.
of course the soft drinks and all of that.
Yes, ma'am.
So are some of the things we should be asking the primary care physician?
Well, I think that it's important to make sure that any diagnoses that you have, you're aware of them. You know, you meet these people who say, are you diabetic? And they'll say, I don't think so. It's not really a question like that. You need to know if you are or not, because you know what you're watching and what you need to be watching. Seeing your primary care physician, just having one on paper is not good enough. You actually got to show up and go to those appointments and listen to these people and try and do what they're saying, keeping your blood pressure controlled. As you said before, monitoring your eating, having them check your urine. You know, I don't think it's a bad idea to look at your urine at least once a year. Make sure you don't have protein or blood in your urine. Some of these things can come out of nowhere. It feels like it comes out of nowhere.
But there have been some little signs
that maybe you weren't paying attention to.
So we should be asking the primary care physician what the level.
To check their urine, asking them about your kidneys, asking them, did you take a look at my kidneys? Are my kidneys okay? Because they have these labs that often they do anyway, and they're very knowledgeable, and they know when to say, okay, there's a problem here, and when they can say, okay, you're fine. And if you're fine, great. That's peace of mind.
Okay. But we still need to ask.
Asking questions is never bad.
I just think that you can even ask people what medications they're on, and a lot of folks don't know.
Exactly.
And they don't.
Exactly.
Right.
And all of my patients out there can say, I always tell them, how are you putting something in your mouth and you have no idea what it is?
I know.
I said, if I reach in my pocket and pull some little pill out and just hand it to you, you're going to take it. No. You need to know what you're putting in your mouth. So don't just randomly accept something. Have some knowledge about your own health.
Yes.
Don't
we
just
have to
assign
own
your
it.
health to others. Own your own health. We're partners taking care of you. I'm partnering with you to help take care of you.
Right.
But I don't want you just to throw the ball to me and then you just walk off the court. We're
Okay.
playing this game together.
Oh, I love that. That's a great analogy. Another thing that I think we abuse in the community is the Alka-Seltzers and the Aleve.
Over
I'm glad that you
Oh,
touched on
Lord,
that.
the goody powders.
Oh,
you know,
God.
it's like I was as a child. I was like, if you could buy it for a nickel, I didn't even want it as a child.
You had good sense.
Yeah, it's like if it will stop your head from hurting, it's 5 cents. I didn't want
There's
that.
something wrong with
but
that.
I still know people today. I won't call their names,
Yeah.
but they are still taking goody powders. That stuff is not
It's
good.
terrible for you. People have to understand just because something's over the counter doesn't make it okay.
Okay.
And we constantly talk about NSAIDs, non-steroidal anti-inflammatory drugs. Bad, bad, bad for the kidneys and the stomach, I'll mention. It can
Right.
eat away at the lining of your stomach. So the gastroenterologists don't like you have that either.
Okay.
So
We got to
patients-
start paying
we
attention.
got to start paying attention. It's
Right.
not good to have to take something like that chronically. You know, I have people that'll say, "Oh, I've been taking it twice a day for about 10 years."
Whoa.
Really?
Really?
There's something not right about that,
Yeah,
you know?
right.
And so we just need to think about these things. Over the counter doesn't mean it's benign.
Okay, all right. That's a good point. Well, it's so nice to have you on this awesome team, and I know that we're going to be out in the community doing some great things, and
Absolutely.
you'll get a chance to meet more people, and I just think that you're a wonderful addition, and now Dr. Smith won't have to be the only female.
Yay.
All right, you all can get it done. But thank you all so much for your support and all that you do
Thank
to
you
take
for
care of
having
people
us.
in the community.
Thank you. Thank
All right. This has been straightforward. If you don't stand for something, you will fall for anything. Until next time, be blessed.